Hey guys, so I'm going to be doing some videos. As you guys know, we've closed the office, and I know for some of you, um, it's going to be tough. So I'm going to be giving you some strategies, some health tips as we go along. So the first thing that I wanted to do was talk about the use of ice and heat. Now, when we use ice, oftentimes I like ice, especially at the beginning of any kind of pain, acute pain, generally speaking, anything from a moderate, severe pain. Typically, when there's a acute injury or a sudden injury, there is a lot of inflammation. So these things are awesome, okay? And these are ice packs. Generally, what I tell patients to do is to get a cold compress. Got some paper towel here, and basically use the paper towel. We fold around it, wrap it, and put it on the area where you're experiencing the pain. Usually, I recommend putting it on for 10 minutes. After the 10-minute mark, we want to remove it. Put it back in the freezer for another 10 minutes. And then after that 10 minutes, you can reapply it back onto the area. Okay, so that's called the 10 on, 10 off, 10 on cycle. And you can repeat as necessary. The important part is to be able to take it off. Because if you put it for too long, it could be too cold for the tissues and may actually create negative effects. And then the other aspect is using heat. Typically, I'd recommend heat for more of tightness, stiffness, maybe more mild, moderate pain. And so if you're in that situation where it's a chronic problem, something where you feel, some tightness and stiffness and just need to get looser, heat's a great option. Basically what that does is it increases circulation to the area, warms up the tissues, and gets you moving better. You can use the compress, and of course just read the instructions for your specific compress. In this case, in this one here, you would put it in a container filled with water. Obviously, all of it is submerged in the water. And then you would actually put it in the microwave, and you could heat it for several minutes. In this case, this one's for 4 minutes. Okay. After it's heated up, don't touch the heat compress, obviously. Use some tongs, and then put it in a towel, wrap it in a towel, and then place it on the affected area between 10 to 20 minutes. Okay. Just as a heads up, so those are the basics behind ice and heat. Just as a note for you, it's not always textbook, and the science more recently has been conflicting as to how we traditionally use ice and heat. Sometimes, or lately, there've been literature that ice might delay healing. And the most important part of any kind of injury is to make sure you keep moving. Okay, so that's part of that as well. Obviously, if you're in excruciating pain and you can't move, ice is a great option. However, having said that, once you're able to start moving, it's important to start moving as best you can. So this is where sometimes you have to experiment between ice and heat depending on what's been going on with you. So heat can work well for people. I still don't recommend it initially for an acute injury, but for some people that are more in the subacute phase or are starting to start to maybe feel a little bit better but are still in pain, sometimes it might be an experimentation where you use heat. Heat might work better for you. Some recommendations I've done is using heat in the morning to help you kind of loosen tissues up, And then in the afternoon, as the day goes on, to use ice to help calm any kind of pain that you may be going through. So that's pretty much it. If you're experiencing pain, use ice, use heat, depending on the situation. It's a great way to help with pain naturally. Obviously, I'd love to be there with you guys and helping you out, but at this point, this might be one option for you. Okay, so I hope you guys have an awesome day, and I'll talk to you soon.